Okay.
In this video, we will present the 2022 through 2027 Illinois Comprehensive Cancer Control Plan's Health Equity section. This is the IDPH vision and mission statements. The 2022 through 2027 Illinois Comprehensive Cancer Control Plan is available to view and download on the IDPH website at the link shown here. The plan provides a roadmap to guide cancer prevention, screening, treatment, and survivorship activities throughout Illinois. The plan is intended to mobilize stakeholders and partners through prevention and control efforts. Execution of the plan will require a collective effort by stakeholders and partners. The Health Equity section is available on pages 82 through 111 of the Cancer Plan. In this section, we will discuss health equity and how health disparities impact cancer, screening, early detection, and treatment. Health equity is defined as the attainment of the highest level of health for all people. Health disparities are defined as health differences that are closely linked with social, economic, and/or environmental disadvantages. Health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identification, geographical location, or other characteristics historically linked to discrimination or to exclusion. The Illinois Comprehensive Cancer Control Program entered into a collaborative agreement with the University of Illinois Cancer Center's Community Engagement and Health Equity Office to implement a community engagement strategy for the 2022 through 2027 Illinois Comprehensive Cancer Control Plan. The community engagement strategy focused on ensuring the plan would include the voices of cancer patients, cancer survivors, and caregivers. The overall goals of the collaboration were to develop a plan to engage diverse stakeholders in the development process of the plan, receive community feedback on cancer disparities and needs in Illinois, integrate community members' perspectives into the plan, and raise awareness of the plan. Enlisting the participation of stakeholders from the community ensures that the 2022 through 2027 plan reflects the expertise, voices, and priorities of Illinoisans who are directly impacted by cancer, including cancer patients, survivors, and caregivers. A virtual town hall meeting was held in January 2021 with 62 participants. During the 90-minute virtual town hall and in breakout rooms, participants discussed how cancer impacts their life, strategies to improve cancer outcomes in Illinois, and what the state can do to improve cancer disparities. As a follow-up to the town hall meetings, focus groups were held in March and April 2021 to delve deeper into themes about health equity and cancer disparities. Interested individuals were asked to complete a basic demographic form that included questions about geographic residency in Illinois, whether they were a cancer survivor and/or caregiver, insurance status, and race and ethnicity. Participants were selected to maximize group diversity and to ensure a broad group of individuals were represented in the 8 focus groups. 3 general population focus groups were held, as well as focus groups specifically for rural residents, survivors, young survivors, caregivers, and Spanish speakers. The characteristics of the town hall and focus groups are found on pages 83 through 87. This screen shows some of the characteristics of the focus groups. 62% of participants were cancer survivors, 47% of participants were caregivers. 38% self-identified as African American or Latinx. 68% had private insurance, while 6% were uninsured. Town hall and focus group participants described how fundamental causes, the physical and social context, individual demographic and risk factors, biological responses, and pathways contributed to the disparities across the cancer continuum for Illinoisans. Participants were then asked to recommend and prioritize strategies to address cancer disparities in Illinois. These strategies were organized and presented by policy, systems, clinical, community, and individual level recommendations. The factors contributing to the disparities and strategies are found on pages 87 through 98. The topic of COVID-19 was discussed repeatedly, and not only in relation to the cancer continuum. These focus group conversations included discussions of health equity, as well as the fear and uncertainty surrounding COVID-19 as it overtook the U.S. health system. The discussion surrounding COVID-19 and health equity is on pages 99 through 101. A summary of COVID-19 is on pages 114 to 115. Illinois residents residing in rural areas face unique challenges and health disparities that impact cancer prevention, screening, early detection, diagnosis, treatment, and survivorship. A discussion of the factors impacting rural health and strategies to enhance access are found on pages 102 through 107. The lesbian, gay, bisexual, transgender, and queer or LGBTQ communities are disproportionately affected by cancer. LGBTQ communities are at risk of poor access to cancer prevention, screening, care, cancer survivorship, quality of life, and cancer outcomes. Due to stigma and stress, LGBTQ people may be more hesitant to disclose their sexual orientation and gender identity to their healthcare providers, which may decrease their cancer survivorship outcomes. On pages 108 through 109, we list several strategies. General strategies to address health equity and health disparities are listed on pages 110 to 111. If you have any questions, please feel free to contact the Illinois Comprehensive Cancer Control Program at dph.compcancer@illinois.gov.